Welcome to Pediatric Case Review. Today's lecture focuses on Friedreich ataxia, the most common inherited ataxia. This progressive neurodegenerative disorder affects multiple systems and has significant implications for patients. Let's explore its clinical features, diagnostic approach, and management strategies. Let's start with a clinical case. A 14-year-old boy presents with progressive difficulty walking and frequent falls for the past 2 years. Which symptom is most likely to be present? A. Intentional tremor. B. Hypertonia. C. Gait ataxia. D. Chorioathetosis. The correct answer is C. Gait ataxia. Gait ataxia is typically the first and most prominent symptom of Friedreich ataxia, usually appearing around puberty between 8 and 15 years of age. Patients demonstrate a wide-based, unsteady gait that progressively worsens over time. Hypertonia is not characteristic, as patients typically have hypotonia or normal tone initially. Here's our next case. A 12-year-old girl with suspected Friedreich ataxia is being evaluated. Which of the following speech patterns would you most likely observe? A. Stuttering. B. Scanning speech. C. Apraxia of speech. D. Normal speech. The correct answer is B. Scanning speech. Patients with Friedreich ataxia typically develop scanning speech, which is slow, measured, and has irregular emphasis on syllables. This dysarthria results from cerebellar dysfunction and becomes more pronounced as the disease progresses. Speech therapy is important for maintaining communication abilities as long as possible. Which non-neurological manifestation is commonly associated with Friedreich ataxia? A. Hypertrophic cardiomyopathy. B. Pulmonary fibrosis. C. Renal failure. D. Hepatomegaly. The correct answer is A. Hypertrophic cardiomyopathy. Cardiac involvement occurs in 60 to 80% of Friedreich ataxia patients, typically presenting as concentric hypertrophic cardiomyopathy. This is a significant concern as cardiac complications are the leading cause of death in these patients. Regular cardiac monitoring with electrocardiogram and echocardiogram is essential. During neurological examination of a 16-year-old with Friedreich ataxia, which reflex finding is most characteristic? A. Hyperreflexia in lower limbs. B. Absent deep tendon reflexes. C. Clonus. D. Preserved reflexes with reinforcement. The correct answer is B. Absent deep tendon reflexes. Areflexia, particularly in the knees and ankles, is a hallmark finding in Friedreich ataxia. This occurs due to degeneration of dorsal root ganglia and sensory nerve fibers. The absence of deep tendon reflexes is typically an early and consistent finding that helps distinguish Friedreich ataxia from other cerebellar disorders. A 15-year-old with Friedreich ataxia is being examined. Which skeletal abnormality would you most likely observe? A. Kyphoscoliosis. B. Lordosis. C. Genu valgum. D. Craniosynostosis. The correct answer is A. Kyphoscoliosis. Scoliosis is present in approximately 80% of patients with Friedreich ataxia and often requires orthopedic intervention. The spinal curvature is progressive and can become severe enough to cause respiratory compromise. Regular monitoring and early intervention are important to manage this skeletal manifestation. What is the primary genetic defect in Friedreich ataxia? A. Point mutation in the FRDA gene. B. Trinucleotide GAA expansion in the FXN gene. C. Deletion in chromosome 21. D. Duplication of the SMN gene. The correct answer is B. Trinucleotide GAA expansion in the FXN gene. Friedreich ataxia is caused by GAA triplet repeat expansions in the first intron of the FXN gene located on chromosome 9q21.11. This expansion reduces frataxin protein production, which is essential for mitochondrial iron handling. The condition follows autosomal recessive inheritance, with most patients homozygous for the GAA expansion. A 13-year-old with progressive ataxia is suspected to have Friedreich ataxia. Which diagnostic test would most definitively confirm the diagnosis? A. Brain MRI. B. Nerve conduction studies. C. Genetic testing for FXN gene. D. Lumbar puncture. The correct answer is C. Genetic testing for the FXN gene. This is the gold standard diagnostic test for Friedreich ataxia, identifying the GAA repeat expansions that cause the disease. Genetic testing can also determine carrier status in family members, which is valuable for genetic counseling. While other tests may support the diagnosis, only genetic testing provides definitive confirmation. What would you expect to find on nerve conduction studies in a patient with Friedreich ataxia? A. Normal sensory and motor conduction. B. Reduced sensory action potentials with preserved motor conduction. C. Reduced motor conduction with preserved sensory action potentials. D. Conduction block. The correct answer is B. reduced sensory action potentials with preserved motor conduction. Nerve conduction studies in Friedreich ataxia typically show absent or markedly reduced sensory nerve action potentials, reflecting the sensory neuropathy that characterizes the disease. Motor conduction velocities are usually preserved until later stages of the disease, helping to distinguish it from other forms of peripheral neuropathy. A 14-year-old with Friedreich ataxia has evidence of cardiomyopathy. Which medication might be prescribed to manage this complication? A. Levodopa. B. Idebenone. C. Riluzole. D. Baclofen. The correct answer is B. Idebenone. Idebenone is a synthetic analog of coenzyme Q10 with antioxidant properties that may improve cardiac function in Friedreich ataxia. Research suggests it may reduce cardiac hypertrophy and improve cardiac output, though evidence for neurological benefits is less conclusive. While approved in some European countries, it remains investigational in the United States for this indication. Which of the following is the most appropriate management approach for scoliosis in Friedreich ataxia? A. Observation only. B. Bracing followed by surgical correction if progressive. C. Immediate surgical correction regardless of severity. D. Physical therapy as the sole intervention. The correct answer is B. Bracing followed by surgical correction if progressive. The management of scoliosis in Friedreich ataxia typically begins with bracing for curves less than 40 degrees in growing children. If the curvature progresses beyond 40 degrees or continues despite bracing, surgical correction is usually recommended. A multidisciplinary approach involving neurologists, orthopedic surgeons, and physical therapists is essential for optimal management. A 17-year-old with Friedreich ataxia is found to have elevated blood glucose. Which endocrine complication is he most likely developing? A. Diabetes mellitus. B. Hypothyroidism. C. Addison's disease. D. Growth hormone deficiency. The correct answer is A. Diabetes mellitus. Diabetes develops in approximately 10 to 30% of patients with Friedreich ataxia and is typically insulin dependent. The diabetes is related to pancreatic beta cell dysfunction and impaired insulin secretion rather than insulin resistance. All patients with Friedreich ataxia should undergo regular screening for diabetes with fasting blood glucose or hemoglobin A1C testing. Which cardiovascular complication is the leading cause of mortality in Friedreich ataxia? A. Myocardial infarction. B. Arrhythmias. C. Heart failure. D. Stroke. The correct answer is C. Heart failure. Progressive hypertrophic cardiomyopathy in Friedreich ataxia often leads to heart failure, which is the most common cause of death. Heart failure typically develops in the third or fourth decade of life. Arrhythmias are also significant contributors to mortality, and sudden death may occur due to cardiac causes. Regular cardiac monitoring is essential throughout the patient's life. A 10-year-old presents with progressive ataxia. Which finding would be least consistent with Friedreich ataxia? A. Family history of similar symptoms in siblings. B. Hyperreflexia. C. Onset at age 8. D. Pes cavus deformity. The correct answer is B. Hyperreflexia. Areflexia, or absent deep tendon reflexes, is a cardinal feature of Friedreich ataxia due to sensory neuronopathy. The presence of hyperreflexia strongly suggests an alternative diagnosis such as hereditary spastic paraplegia, multiple sclerosis, or vitamin E deficiency. The other options listed, family history of similar symptoms, onset at age 8, and Pes cavus deformity, are all consistent with Friedreich ataxia. What is the typical life expectancy for a patient diagnosed with Friedreich ataxia? A. Normal life expectancy. B. 40 to 50 years. C. 60 to 70 years. D. 20 to 30 years. The correct answer is B. 40 to 50 years. Patients with Friedreich ataxia typically have a reduced life expectancy, with most living into their 40s or 50s. Earlier disease onset generally correlates with more severe progression and shorter lifespan. Cardiac complications are the primary cause of mortality, though improved cardiac management has extended life expectancy in recent decades. Thank you for joining us for this overview of Friedreich ataxia. Remember that a multidisciplinary approach is essential for managing this progressive condition. Emerging research targeting frataxin production offers hope for future therapies. Please follow the Pediatric Case Review channel for more informative presentations on neurological conditions. If you have questions, please leave them in the comments section below. We appreciate your support.